something like this, maybe not quite the complexity of this, and you say, oh my God, I'll never be able to do this. And the answer is, when you see a stack of books that are this high, you've got that much work when you come home at the end of the day, the question is, how are you ever going to get that done? And the answer is, the way you're going to get it done is to do the next thing you have to do. And then do the next thing that you have to do. And then do the next thing that you have to do. Do not worry about there's so much I have to do, I can't possibly ever take care of that, or I can't master it. Worry about a little segment of this. Someone will teach you that. Pretty soon you'll see the whole picture. That's the reason I showed you this slide, not to make you sick. Okay, so what I wanted to do, but did you all get down all those pathways? Did you write those down?
Yeah.
I'm going to teach you that.
Yeah.
No, be on the test.
It's on the test. It's on the test. All right. So, what I want to do is I want to spend the last couple of minutes just talking to you about a couple of things in my story to let you know that things don't always go smoothly. And there are times when all of us have difficulties. There are times when all of us have obstructions. And it was very interesting because I was asked to come to Cleveland in 1992 to set up a big heart disease prevention program at Case Medical Center. And I was recruited from the University of Michigan, where I was at that time, where I had done a similar program. And they wanted me to come and set up a big program here. And I made the decision, I moved with my family. And about 2 weeks after I got here, every person who recruited me left. Some went to Hopkins, and some went to Yale, and everybody, all the people in the administration who recruited me left. My wife came down with recurrent breast cancer. And I was in a situation, and I had 3 kids, 3 small kids. So I was in that situation where I said, how can this be happening to me? So after about 2 years, I did the best I could, but my focus, of course, if you had to decide between making sure your small kids are going in the right direction when your wife is getting ready to die, and she died pretty shortly thereafter, or deciding to move ahead in the biggest possible way with a large program, you do what you have to do. And I had to make sure my family was taken care of. My children. These were my children. No one else is going to, I mean, I could hire people, but no one's going to really take care of my children the way I wanted to take care of them. So I made that decision. So I went into a multi-specialty group practice with other specialists, and it was totally different than what I planned. I took care of my kids, subsequently remarried a wonderful woman, but what happened was I continued my dream. My dream was always there. I never let go of it. I wanted to set up a world-class preventive cardiovascular medicine program. It was something that was in my, deep inside me. So there were obstacles. And the question is, how do you take opportunities when they are given to you? So sometimes you have to make opportunities that aren't given to you. 2006, a new head of cardiology came along from Harvard, brought a large group of people with him, and he said, and I met him, and he said to me, maybe you'll be one of our doctors who will send patients to us. And I said, maybe I have bigger ideas. Because by then, my life was back together, my kids were getting grown, things were moving well, had a wonderful marriage, beautiful. So I said, I want to show you something. So I developed a program which has the ability to detect heart disease early, when you have just those problems in the walls before it becomes a problem in the channel. And it has to do with a CT scan. Patient lies on here, and the CT scan, the bed is moved into the CT scanner. It's about a 2-minute x-ray of the heart. No intravenous needed. Test takes 5 minutes. The radiation exposure from this test is 1/4 that of a mammogram. Very, very, very low radiation exposure for the patient. Interesting. And what does that show you? Well, here's what it shows. Here's how it works. There's a beam that comes down a chamber and hits these rings and goes right up through the patient's heart. And then there's a camera on top of the patient that takes a picture of what is seen. And what do those pictures look like? Well, they look like this. Now, these may look like globs of garbage to you, but in fact, these are CT scans of the heart, of different parts of the heart tissue. And this is one of the coronary arteries. And this artery has no calcium in it, no cholesterol deposits. And this artery has a little bit of calcium in the wall, meaning there's cholesterol deposits. And this artery has a ton of calcium in the wall, meaning there's a lot of heartbeat in the arteries, a lot of those deposits we talked about. Calcium goes where cholesterol goes, and that's why this test is so important. This is a high-risk patient because of all of the hardening of the arteries. This is a low-risk patient because there's no hardening of the arteries at all. Okay? So I developed a program, which I decided I would call EDUCATE, which stands for Early Detection Using Calcium Scoring for the Treatment and Elimination of Coronary Heart Disease. Good name, huh? Mm-hmm. All right, so, and what do? We actually have now screened, as of February 28th, 7,226 patients. And we've done this test on those patients. And what we determined was that of all those patients, and when patients are properly selected, we found out that 45% of those patients actually are much lower risk than you thought. And some of these patients who are very low risk are being treated with lots of expensive medicines, and they don't need them. And then, on the other hand, we found 626 patients who are extremely high risk, and they didn't know it. They're walking around as time bombs, and they didn't even know it. And these patients, we are getting on all sorts of preventive treatments to make sure they never get heart attacks, which is extremely exciting because in my world, what do I want to happen? The answer is nothing. I don't want them ever to need a stent or a bypass or an angioplasty or get a heart attack, any of that stuff. My job is to make sure these high-risk patients never get into trouble. But how can I tell who it is until we define who they are? You can't do it because if they just walk into your office, because remember, you could be walking into your office with those caked arteries and have no symptoms. We needed a way to figure this out. So I figured this out. Okay? Well, that's kind of nice. But let's talk about the implications of screening people. If you think of 78,000 fans at Cleveland-bound Stadium and apply those numbers, that means that 7,020 of those fans are going to be at high risk. And at Cleveland-bound Stadium, it's probably like 17,000. Of course, you see most people there. But the answer is there are definitely 7,020 people in that stadium who are at high risk and they don't know it. If Progressive Field somehow by miracle fills up in the future, there are 3,780 high risk, and if you have 21,000 at the queue, 1,890 people are high risk. So we want to figure out who those people are and get them going on treatments like we talked about today. They're going to prevent them from getting into trouble. So here's the deal. This is the last slide. So it's May of 2008, and I've been speaking to the head of cardiology over at the hospital, and he says, come and try to do some of your programs here. And I said, great. So turns out this gentleman, Ron Harrington, brings in his wife, Nancy Harrington. He says, we were down in Florida, and they did one of those calcium scoring tests on my wife, and the doctor wasn't quite sure what to do with the information, and I was wondering if you might be able to help me. I said, it's very interesting. I said, I just set up this program, and I'm getting ready to go present it at a national meeting, and it's actually a way we can detect heart disease much earlier on. He said, geez, I'm very interested in that. I said, well, the way we do it is we do a cardiac CT scan, and then when we find out who's at high risk, we get additional blood tests, and we protect these people against heart attacks, and this is what he says, no, I'm really interested in it. I said, maybe that means he wants to give some money. And I didn't know from Adam if he had any money or not, because to me, I take care of people who own sports teams in this town, and I take care of people who clean up the stadiums after the sports teams are finished. To me, it makes no difference. They're all my patients. They're all suffering, all got trouble. So I don't care. I never knew he had any money, but he said, you know, I'd like to give you some. So I thought, geez, maybe he would help to support one of my research programs, and maybe I could help do more research. Well, turns out that was in May of 2008. And in August of 2008, the Harrington Family Foundation, which I didn't know existed, gave $22.6 million to university hospitals to completely support my research program and to provide $20 million for the head of cardiology to bring in the best people from the world to make cardiology unbelievably strong in university hospitals.
Wow.
Now, so to say that changed my life was a small statement. But the reality is, it all happened because I wanted to do the right thing. But you want to hear something better? Do you want to know why this program happened? Why is it that we do this calcium scoring program? Why can we do 7,200 patients? The answer is we do the test for $99. You might say, well, what's the usual cost? The usual cost is about $400 or $500 in most places across the country, and it's not an insurance-covered test because it's a prevention test. So why do we do it for $99? Here's why. The radiologists, the people who interpret the test at University Hospital, do it for free.
Oh.
And University Hospital has agreed to put people on the scanner to do this test, even though they could put people who could get them much more money on the scanners to get more expensive tests. Why? UH did it for the right reason. The radiologists do it for the right reason. I did it with no financial thoughts in my mind. All that happened before this gentleman gave our hospital $22 million. We did something for the right reason, and look what happened. And we never anticipated it would happen. So now I think back to 1992, when my wife was dying, and when I had little kids, and everybody who had recruited me left. And I thought, geez, why is this happening to me? Well, now I know. Okay? So the answer is, I don't know whether someone will come along and give you or your program $20 million one day. Maybe they will, maybe they won't. But you know what? It doesn't matter, because if you can help one person relieve their suffering, you can prevent heart disease in somebody. Or, you don't have to necessarily be a doctor. If you want to go into some field in medicine, allied health professions, tremendous help. Nurses take care of people in the hospital, make their lives whole again when they're in for surgery or for other procedures. You've done so much. You've done something that's so important. It's huge. So it's a privilege to be thinking about going into medicine. There's hard work, and there's long hours, and there's lots of time involved. But you know what? You folks are at the threshold of doing something important, and you can do it. Picture yourself in that. Make the commitment to study hard and do what it takes, and things are going to fall into place. Okay? So, Sarah, how much time do we have left?
We have about 15 minutes.
Okay, let's have any questions any of you have. Ask me now. Yes?
You said that you want to, there's people that don't know that they are at risk of this. And you said, like the people that you examined, maybe they complain about it. But if the people that don't have enough fatty, like fatty on their arteries, how do you know if they're at risk or not?
Right, how do you know if people are at risk? And that's a great question. Because a lot of people come to me because they were referred in by their doctor because a doctor saw them for a checkup, the doctor did a blood test, and lo and behold, the blood test showed that they had high cholesterol in their blood, or they had high blood pressure, or they have high blood pressure, high cholesterol, and they happen to be smokers, or they have a family history of heart trouble. So we have ways that we assess these things by a history, talking to the patient, a physical, doing an examination on the patient, and then we determine if that patient's at higher risk. And then sometimes we have them undergo that cardiac CT scan to see if they actually have fatty deposits in their arteries. Once we find out that information, we get them going on good dietary plans, on exercise, and on the right medications to reduce their risk. Now, sometimes they've already had a heart attack, and our job is to prevent recurrence. Sometimes they're at risk for a heart attack based upon those risk factors, where our job is to make sure that they don't get a heart attack. Yesterday, the last patient I saw at the end of the day, 52-year-old guy who's exercising 6 days a week. He's He's, for the last couple of years, been eating a low-fat diet.